It's been a while.
All right. Thank you, Stephen. By the way, Vegas, I mean, what sort of do in Vegas? That sounds awfully sleepy.
Lack of sleep, you mean?
Exactly. So looking forward to it. So what are we talking about tonight? Talking about case acceptance and the resultant practice growth. I cannot tell everyone how happy I am to be here tonight. This is a great group. We're talking to a group of progressive clinicians who are looking to expand not only the size of their practice from a business standpoint, but expand and penetrate more of their patients and connect more of their patients with quality care. That's what it's all about. And I could not be more thankful to have Dr. Daoud with me tonight. So we're going to pair real life experience with some technology and new process solutions and some learnings that we've had. So looking forward to get right in. And so, the mission of this group, as I understand it, is, increasing access to high quality care, which is, we're a very mission driven company ourselves. And that's really what is at the head of all of our mission and vision statements, is connecting patients to high quality care. And so how do we do that in a more effective way? Dr. Daoud, when you and I were preparing for this and toiling over these slides, we were talking a little bit about, what your observations are in terms of this challenge.
Yeah, absolutely. And just to kind of touch on, the mission part, obviously, it's a beautiful line. I actually have this quote in my office on the wall, and it's a quote from Dr. Galler, and it's a beautiful, healthy smile enables a person to reach their maximum potential in life. And I remember when he first came up with that, I thought, wow, this is actually just a little bit more beyond teeth, right? So I think that's important for us to kind of realize. I think sometimes we get bogged down. We're looking at teeth, we're talking about teeth, and I think it's important to be able to kind of take that step back and think about, okay, what is the bigger picture? Because I think it's important to have that purpose, right? And that to me drives home the message that we're trying to bring to patients, the message that we're trying to bring to our team, and really the message that we then take home to our families into our personal lives. So I love that mission statement. I think your mission statement kind of ties in very nicely with what we're doing at the AACA, and which is why I think this will be a great partnership. So start out by saying, it was a tough day, right? I mean, I think, what do we encounter on a daily basis, right? I mean, let's talk about it. So, we go through dental school, we train to become dentists, right? We become experts at, diagnosing, looking at x-rays, doing oral cancer screenings, fillings, root canals, crowns, people that branch into ortho, other specialty, dentures, which I try to avoid as much as possible, but they seem to find me somehow. And we receive all this clinical training. And when we get to dental, when we start working, it's kind of like, when I go to my doctor, right? My doctor tells me, Amir, you need to do this, this, and this. And basically, I pretty much do it. But he doesn't have to talk to me about money. He doesn't have to give me a case presentation, right? Whereas then I compare it to like what we do, and it's, okay, so we go in, we meet a patient, we diagnose. First, we get to know them, right? And get to understand them a little bit. And there's an art form to that. And to me, and if we really talk about case presentation, I think it's important to understand what is that person's core value? What is that person's barrier to accepting treatment? And, one of the biggest barriers in dentistry is budget. And we present this treatment, and it's medically the right thing for them to do. It's medically the best thing for them to do. But then there's that part, right? Okay, well, that's great, doc, but what does this cost? I don't believe I've ever asked a physician how much something costs, but yet in dentistry, that has become standard of care almost, right? I feel like dentistry has become almost commoditized. I think we're partly responsible for that, but nonetheless, here we are, and patients do talk to us about money. And technically, we're the most qualified person in that office to talk about it, because we understand the dentistry. but yet most of the time we're probably the least skilled at answering that question. And certainly I'm guilty of this, where I know talking to other colleagues, it's like, whoa, we don't talk about money, right? I got somebody for that. I'm going to get you my treatment coordinator, and they're going to go over all that. But as long as you like what it sounds like, this is the treatment that you need, you're going to be all right. You just go talk to, they're going to figure out your insurance, and now I run away, right? And I guess, I don't know why. Do we feel bad talking about money? Do we feel guilty? I have no idea. I think it's just kind of, and this isn't just me. I swear I've talked to so many people, and everybody's like, wow, why do we do that? I don't have an answer to that yet. So when I talk to my shrink, I'll figure it out. But
and I think what's
something
interesting
we experience,
is,
right?
And I think what's interesting is like not just that we bring somebody else in to talk to them, but as you mentioned, we're putting so much of the burden and the responsibility on those people to convert all of this dentistry, for you, for the practice, and it's tough. And so, what we want to talk about is there's a lot of reasons why case acceptance is as low as it is in the dentistry space. And, some of these things, I'm not going to be draining slides tonight, everyone can read, but it's not just the financial affordability gap. Everyone wants to go there. It's, people don't have the money. There's also a lot of other things that we've gotten all too used to in terms of what converts. And some of the things that are going on a daily basis are, pretty astonishing. You've got a lot of disjointed case and fee presentation flows. The actual way that practices present fees and present options can be very awkward. Where there's a lot of wait and see and crossing fingers depending on what options people are using. The options themselves are fairly limited. So there's a lot of issues that we probably want to talk about, right? And so, at the end of the day, it's one of two things in a lot of practices. Either the patients are auto-limiting and they're foregoing their treatment that they're presented because they perceive or they really do lack the ability to afford their treatment. Or, and this is very interesting, and we see this very often, including even just last week in one of our beta practices, there's a lot of practices that internalize these challenges and then fail to present comprehensive treatment because they are either wallet sizing or they're anticipating that a patient can't or won't afford or qualify for payments. Dr. Dell, help us out. What's going on?
Yeah, 100%. I think, and again, I don't think any one of us, and I'm guilty of this. I think many of my colleagues are probably listening to this or has experienced this. And I think it's a couple of things. We don't like hearing no, right? Just as the human nature is, we don't like the word, we want to be pleasers, right? We want people to say yes. And so if you go in with the mind, you present enough $20,000, $10,000, $15,000 treatment plans, dare I say incorrectly, right? And what ends up happening is people don't do it. Well, it's quite defeating. So now what you start doing and accidentally, I think you go in the intention of, presenting comprehensively, but because you've heard the word no so many times with different people, you start presenting smaller treatment plans, maybe not diagnosing as appropriately, or maybe taking it upon yourself to decide, okay, well, maybe I'm not going to present the whole treatment plan. I'm going to present them this little portion of it. And almost like babying the patient and then trying to, and then presenting the next part to them once they've completed that. And I think there's a time and a place for that. And I think it comes with a conversation with the patient. And there are some certain times where that is appropriate. But I also think that it can be a little misleading. And you often hear this comment from patients where it's like, well, doc, every time I go to the dentist, I've got more problems. What am I doing wrong? And the truth is, actually, you're not getting more problems. Either the same problems you've been coming in with, we just didn't tell you about them, right? And now, because we didn't think you could handle it, right? So, and I think that comes sometimes possibly from our own insecurities. I also think that, and I, again, early in my career, I was presenting treatment plans that I couldn't even afford myself. And that's difficult, because you kind of personalize it. Now, imagine this, and as a dentist, I think, we have a fairly good living. Imagine now that you're pawning this off to another team member, right, who is now looking at some of these treatment plans and saying, this is more than what I earn in 6 months. And now they have to present it. And yes, we, hopefully they've been trained. A lot of us are guilty of, and I hate the word guilty, a lot of us forget to train these people, or quite frankly, don't know how to train these people to even do a job. And really, you've mastered the dentistry, right? You've got a great treatment plan in place. You've got a patient who is in the building, which means they're actually interested in what, for that short period of time that they're there, they're actually interested in what you have to tell them. Dentistry is important. The minute they walk out of the building, right? Like there's a million other things, but for that hour or 2 hours that you're in the office, they're receptive, and then we bungle it, right? And then, we pass it off to the, I would say the weakest link, but somebody who may not necessarily be very comfortable. And then the worst part is we get upset when they didn't close the case. And another thing we'll talk about is we'll talk about case acceptance numbers, right? I know we were talking about this, Oliver, and we'll get to that, I'm sure, but we don't even know what our case acceptance is. But yeah, we get upset because people aren't doing it, right? So
that's right. That's right.
There's a lot going on.
Some of it obviously is presentation skills and style and technique. And if you don't have a case acceptance consultant where I've worked with them at some point, I highly recommend it. Good training will never replace, tools will never replace training and human capital. That said, there are some gaps in our actual solutions and tools. And so this is, explorations that we've done and data that we've researched. And so at the end of the day, this is what it looks like out there, right? In terms of the average solution to offer patients options if they can't afford the full fee. Right now, what's happening out there is we are mired with generally a single lender solution. And what's interesting is we go at it with a single lender, but since we know that the single lender is likely to reject a lot of patients, we then have a stable of a rotating 2.5 lender solution bullpen. And in the end, think about how disjointed that is. And part of our process of presenting dental treatment is broken partly because we're so mired and tied to the lender. The lender wants to sell more loans. And so they've structured a product that sells more loans when they want to approve those loans. That doesn't necessarily align with the needs of the patient and doesn't always align with the needs of the practice. But because our need for cash flow is so high, we kind of go along with the process and flow that they've built. And it's not really built to serve your interests of converting more cases. It's built to sell loans. And that's the tools that we're using. So there's a lot of things that happen. Collateral, damage from that is, often because of high rejection rates, higher interest, or, kind of the newest flavor is this arms race of advertising high approval rates, which I chuckle about because on the one side, you've got, lenders out there who claim 85% approval rate. Well, yeah, that's great. But if you're approving only a fraction of the actual amount of dentistry that's being, presented and diagnosed, the practice is never going to get that accepted, but the lender can still claim that they approved the loan. So on the one side, you've got 85% approval rates and you've got 35% case acceptance out there. So that just helps to highlight that there's something wrong with the tools. And so this has that effect of, changing the way we present, or if we present financing and affordability. So often, it's only presented after the patient says no. That's actually terrible influence mechanics, right? And so a lot of these things, that are happening. And so when you distill it all down, And Dr. Dowd, I'd love to hear what you think about these three things. But when we look at root cause, it really comes down to these three things that we've kind of been teasing. This disjointed way in which we even have the discussion, the limitation of the offers in general, and then to your point, do we even know what our case acceptance is, right?
Yeah, I think kind of looking at this, I'm laughing because we do this. Have you ever actually looked? I implore everybody to, you know, after today to actually take a look at a printout of a treatment plan, and I swear I can barely understand what's on it. There is just, it's printed on this piece of paper, right? That they go in with, you know, it's on the clipboard and they go in with a piece of paper, and the paper has so many numbers on it. It is so convoluted and confusing. And you got insurance and patient portion and total cost and office fees. And it's like, it is, honestly, I think it's overwhelming because there's just too much information. And I think it actually confuses people. I think it can be difficult. And I'm really working hard to kind of get away from that. And, you know, there's some great things that are coming that I think will help with that. But I do think that is a problem. And you're right. I think what we always, you know, it goes in, you know, traditionally, right? You know, they go in, they present it, and the patient sees the full price. And you know what? A lot of times that's fine, right? A lot of times, you know, I don't know, 25%, 30% maybe of your patients, depending upon where you're at, will be like, okay, you know, I can afford that. I can do this. Maybe, you know, can I break it up into a couple of payments? Sure, no problem. And they say yes, and they go forward. I think the problem is exactly what you said is, and kind of like what we were touching on earlier, I don't like to hear the word no. So if you're presenting the treatment to the patient and they say no, guess what they just heard? They heard themselves say no. And that's not a good situation, because now you're already behind the 8 ball, because they've already said no to the treatment. Now you come back and you're like, oh, but we can get you financing, or we can offer you this. The problem is now you already gone backwards, because they've already somehow convinced themselves that they cannot afford it. And so I kind of joke around. I don't know where I heard this from. It might have been Bruce Baer, but I think he goes, America doesn't run on Dunkin'. America runs on monthly payments, right? And you know, I lease a car, I pay for it monthly. I don't know. I bought my, you know, my cell phone. I mean, we all got cell phones, right? I didn't pay $1,000. It cost me, I think, $1,200 to own it, but I think it's like $40 a month. I mean, I think we are all we all think in terms of monthly payments, but yet we don't necessarily present ourselves in that way. I don't know the last time I saw an ad for a car, not to compare what we do with cars, but sales is sales. I don't think I've seen the MSRP on a car ever. I mean, you got to really look for that dotted line, right? They don't come leading with that. There is a reason for that.
That's right.
I like what you're saying.
That's right. And so, you know, we have to ask ourselves very plainly and honestly, are we actually solving this problem the way we're currently going? I would submit possibly no. And again, it's not, there's no indictment here. I'm not, at the end of the day, we're doing what we do. We're doing the best we know how to do. But I would offer that if you don't put the patient first, you're going to destine yourself to have awkward conversations, and you're going to miss out on opportunities. And so, you know, for my sake, everyone on this call likely knows Dr. Daoud, man about town, great clinician. You might be asking, like, okay, OrthoFi, you may not have heard of OrthoFi, you might have heard of OrthoFi. Why are we listening about potentially an ortho company to help us solve the problem in our dental practices? And what we'll say is that OrthoFi, granted, started in the specialty space, and now we're working with a lot of large multi-specialty enterprise clients. At the end of the day, what you need to know is we have tested technology process on over 1 million successful starts over the last 10 years. We've processed over $5 billion in orthodontic production. And we've leveraged the best technology in terms of consumer behavior and process to deliver roughly 5 times the average annual growth rate for a specialty practice, and over double their rate of same-day contracts by leveraging this technology. So we believe that we have some really great solutions to bring over to this space. And so we're really excited about this opportunity and developing this solution. Now, that said, I don't want anyone on the call to believe that we are oversimplifying what is a much more complex flow. In the dental practice, it is not as simple as it is in a specialty practice where people are self-nominating for treatment and calling because they already believe that they want that treatment. It's still not easy, but it's much simpler. And so the flow that you see in the magenta color is likely what it looks like at an ortho practice. At a dental practice, what you live most of the time is this circular wheel of, being on the hygiene wheel and trying your best to diagnose and identify potential opportunities in that wheel to sort of intercept and extricate out of that wheel and possibly recommend elective treatment to. Now, how and when you do it, how effectively you do it, who does it, and how timely you are with that is separates the men from the boys, right, if you will. So, Dr. Daoud, before we were even talking about AcceptCare, tell me what, looking at this, how you feel about this.
I'm looking at this thinking, no wonder I go home with a headache every day, right? I mean, it's so true. I think we have to give ourselves a bit of a pat on the back, right? As dentists, we deal with all of this. Again, I look over at my, specialty practice, but, even further, I look at my friends that are doctors. They don't know any of this. They don't deal with it. They don't even think about it. They just go in, they're clinicians, they walk out the door, right? But this is our reality. This is our real life. And it's funny, I'm laughing because you're saying is about, people, calling the special, if you're going to the orthodontist, there's a very high chance that that you need to get braces. So I almost call it, I forget, there's probably better terminology, but you already that's a buying response, right? I mean, I'm sure you're a marketing guy, you probably have a much better term for it, but you're already going to buy something, right? Whereas when the average patient comes into the dental practice, unless they have a toothache or, they are extremely aesthetically minded or they know they have a problem, a lot of times what we're doing is we're examining them and, they're sitting there going, I swear I can hear this telepathically. They're going, please don't find anything. Please don't find anything. Please don't find anything. And you're almost like, yeah, I don't really want to find anything, but am I supposed to do my job? Or am I supposed to look, am I just not supposed to look and not find anything? But truth is, we kind of need to diagnose it because A, it's the right thing to do, but 2, that's what we do, And so the reality is most of the people walking into my office don't want to buy what I have to sell. And I'm competing against a lot of other things they want to buy, like the Gucci handbag or the,
That's right.
A few other things. So
right.
I think this diagram is I'm laughing at it because I kind of realize, this is basically every day. So
what I'll say is I can't necessarily help you with the left side of this diagram yet. We certainly are working on, coloring more of this magenta, but what we can talk about tonight is how we can make this patient influence and conversion part a lot more streamlined and a lot more effective based on, what we do. So, without the drum roll, we're going to talk about AcceptCare. It is the only, all-in-one fee presentation solution that is designed to increase case acceptance. That is not a lending tool. It is not, if you're looking for just another financing company to replace a Care Credit or a Sunbit or whomever you're using lately, and you just want to take them out and plug another financing solution in, this may not be for you because it really is intended to be a lot more comprehensive and really transform the way that you present fees in your practice. But what this is all based on is the proven concept of open choice. And again, we've proven this over 1 million times. So you have the security of knowing that all of these things have been titrated through testing, through years of data analysis and all this. And at the end of the day, what this is designed to do is to take all of your fee options, not just the lending options, but your pay in full options, your possibly whatever your in-house short-term payment plan options that you have, and put them all in one very appealing place on a device in your practice that puts the power of open choice in the patient's hands. What's super important about open choice, and we'll talk about it a little bit, and we didn't really invent it, we just coined the term, but the power of open choice is tailor-made for today's modern consumer. Just think about yourself as a consumer and the way you buy things now. You constantly have a lot more power than you ever did. You can go and price out multiple versions of the same product on Amazon. You talk about Expedia. There's nothing that you purchase where you're not being given a choice. It's not a yes or no proposition. So that's what this is all about. The other thing is we're not tethering you to one lender that is, going to be, where it's on their whim about whether or not to approve a patient. We want a single application to unlock multiple lenders so that you have as many options as possible and as many possibilities to get every patient approved with complete care approval, right? And then, hopefully it goes well. And we want you guys to get more same-day acceptance. But in the event that you don't get same-day acceptance, we want to leverage modern technology that sends all of these payment terms and treatment plans home so that it gives the patient the opportunity to have this experience in the place where they're comfortable and be able to approve from any device from home. And if they don't do that, we want to keep after them and follow them in a way that most practices fail to do because everyone's so busy. The next patient up to the front desk, the focus shifts and you're on to the next one, right? And so that's what this is all about. And I know, like, Dr. Daoud, you're early in your journey with AcceptCare, but just if you can share with us like what you're hoping for this and really what you saw in this when you jumped in.
Yeah, so kind of like what I was saying, I was looking at my old treatment plans. I'm like, it's too busy. There's too much in there. And of course, if the patient wants that information, if they're the kind of person that thrives on all that data, which by the way is not that many people, then it works. But to me, when I kind of look at this screen, and first of all, it's on a tablet, it's on a laptop. I think it's just a lot cleaner. I think it just looks better. And what I like about it immediately is you can see very clearly what the investment is going to be. And then you've got three options. And really, it's not a matter of us saying, okay, well, can you afford $2,400? You don't even really have to say very much. And you can just kind of almost like present it to the patient and say, which, you give them, would you prefer this or would you prefer this? And really by giving them that opportunity to choose for themselves, right? I mean, you call it open choice, right? And I think that's nice because now you're giving them a chance to just select without them actually saying no. And before they make a determination as to whether or not they can afford it, they can see in front of them what are the few different things. I mean, was it treatments, what, $5,000 and you can get it for $83 a month. So $83 a month, what is that a day? Who's good at math? Like $2, $2.50 a day. I spend $5 a day at Starbucks, right? And by the way, not just me, I look at my team and my team spends more than I do at Starbucks. So when you really boil it down, $83 a day for $5,000 worth of work, I mean, that's definitely something that you can be like, oh, actually, yeah, I can do this, right? So I'm going
to credit Dr. Galler on coining the Expedia of options. We call it open choice, and so what is compelling here, and there's a lot of science behind it, not just by OrthoFi, but by other leading companies that and I'll show you some examples on the next slide, is this concept of giving the patient the power. I mean, in the very simplest of terms, when you coach on good influencing techniques, you never want to present a yes or no option where you're giving the patient a 50% chance of giving you a no. You really want to present which of these would you prefer, and then give that step back and let them choose. Now, the step back and let them choose is a little scary to some practices. And we're learning some of this, creature comfort, creatures of habit behavior, that practices are a little skittish about presenting financing options, at the same time that they're presenting the full fee, because we get the concern that, well, first I want to see if they'll pay me the full fee now before I even, get into, financing, because I might cut my chances. And I understand that intuitively, but the science actually proves otherwise. And that is by simply providing multiple options simultaneously, you're de-escalating the anxiety. And like I said, we didn't make this up. There are companies that you purchase from today that, the companies themselves that employ other companies that are growing like a weed, the Affirms, the Klarnas, all these pay over time companies that are partnering with these large retailers that have proven that when you present pay in full simultaneously with pay over time options, it increases your likelihood by 20 to 30%. And it also increases the average ticket size by more than 50%. So if you think about the problem we're trying to solve, we're not just trying to get more case acceptance, we're trying to get more comprehensive treatment accepted. So this is the proven way to accomplish that. And so you've got open choice on how do you want to pay just at a high level. Do you want to pay it all today? That's obviously the best value. We typically recommend practices take a small 2 to 3% discount on that pay in full to get it today. You can pay over time, whatever you guys typically do. We can configure 4, 5, 6 month plans. And we have some recommendations and some baselines. And then of course, there are the financing options where if they elect to do that, there's going to be that one application. But once they put that in, we're not only getting their, name, address, employment history, all that stuff for the soft credit check. What we're also doing is getting their preferences. So we want to know what's important to them financially. Do they want the lowest monthly payment? That's what most patients are opting for. Do they want the lowest down, if there's a down, or do they want the lowest total amount, meaning they don't want to pay a lot of interest? And based on what they tell us, we're going to pre-select among all their offers, the offers that actually match their preferences best, and still give them a choice. So again, it's still open choice. I'm giving you a choice between these lenders. I might have 10 offers, but I'm not going to paralyze you by showing you 10. I'm going to give you the best 2 or 3 that kind of fit your terms best. And psychologically, that gamification is proven to work. So this is pretty different. I mean, Dr. Daoud, how did your team react to doing things differently and doing it this way?
I think like anything new, I mean, if I'm honest, right, there's always, you bring in a new product, you bring in a, doctor goes on a course and comes back with these exciting ideas. There's always a little bit of trepidation and pushback. However, what we're starting to see is when you make, it's about how you present it to the team, right? If you present it to the team as this is one more chore, this is one more thing that you have to do, then that's one thing. But when your team has bought in and has as an ownership mentality in the practice, right? And we can go off on a tangent and talk about incentivizing your team, etc. But when your team is bought into your vision and are willing, see your goal, and you present this in a way that says, look, this is a way for us to help more people. It will help reduce the follow-up, right? Because I was laughing because follow-up, man, you were talking about follow-up. I got $5 million in outstanding treatment, right? That's outstanding treatment. And so, when my schedule is empty, what do? Hey, can you make some follow-up calls? Nobody wants to get a follow-up call from us. They don't. They see our number. They don't answer. Right? It's hard enough to get people on the phone these days anyway, as it is. I feel like no one answers their phones anyway, right?
That's right.
So for me, I like the idea that there's that follow-up factor to it, but follow-up is difficult. So if there's a way to have it automated and almost presented in the same way that it is presented in the office, that way, that person that says, I got to go home and think about it, well, they're going home and they're not necessarily Chinese whispers, they're not necessarily passing on the same thing that you told them about the financing or the options, or they didn't see the same thing that they're seeing in the office. But by being able to then follow up with them with that same platform, I feel like that, I'm sure you're seeing this on your end. I'm sure you're seeing there's a much higher close rate, even post, after leaving the office, which, to be honest with you, is the hardest time to get somebody to do anything, right? So I really do like how that's kind of playing. And obviously we're starting to kind of work with this, and I'm excited about especially that opportunity that it presents.
I've got some great data from our beta that I'm going to share on that. You're going to love this. So what I want to make clear is part of the reason why we're able to do complete care approvals is, and this is one of the reasons why OrthoFi, paired up and with, the compassionate finance solution, is we know that most practices cannot live by in-house financing alone. That said, when lenders are not able or willing to fully approve a patient, you have at least a decision to make. And so by pairing and infusing the compassionate finance option into the platform, what you ensure is that you're going to get complete care approval, that even when a patient doesn't qualify for your conventional option, they're going to have some other options. And because the practice is able to earn the interest and offset the risk, yes, they can do it, right? And so that's really what you have. And then at the end of the day, like, what's also compelling and unique is it's not one or the other. It's not either third party or fully in-house. What we're able to do by combining this network is we're able to stack these loan offers where you can get your 20 or 30 or even 40% of your costs, covered, and by getting that third party option, and then the rest can be done through compassionate if the patient doesn't qualify for full funded care. So when you all put it all together, this is why we're able to, and this is our mission, to get complete care approval. So that's what that's all about. Now, you hit on actual pending treatment, pending management, that follow-up. And this is what teams don't love doing and don't do a great job of doing. They might set themselves some automated reminders, and softwares are good at allowing you to set reminders, but they're just reminding the team to make a call they didn't really want to make and didn't have a lot of confidence was going to be successful. So what are we doing? We're just leveraging automated drip technology. So friendly, informative emails with easy links and buttons that get them right back to that fee presentation, just like you were talking about, Dr. Daoud, like that gets them back to your best story, right? That they can just recreate on their device. And so, it follows them diligently for up to 90 days. And what's super cool is we're seeing 32% of the plans that are accepted 7 or more days after the consult. Now that means that 68% are being accepted either same day or within the first 7, which is awesome. But that 32% is being accepted 70 more days. Many of you on this call, if you're being honest with yourself, probably don't see anywhere close to that, because you don't have a way of staying with the patient over that long a period of time. And now that we're seeing them 30 days, 30 plus days. We're seeing, these continue to come in, which continues to increase your case acceptance. So yeah, Dr. Daoud, what you were saying is on point.
Yeah, I like that. I do, and actually, and I think you're going to touch on this now, but I think it's also the fact that you can actually track it. Numbers never lie, right? I mean, that's just you can run away from them, but numbers never lie. So to me, I think being able to track that case acceptance, obviously you have that data, and I'm assuming that data is also we can customize that for our own practices, right? So we can kind of see, because then it's going to give us an idea. Okay, are we being effective? I look at this as an opportunity to improve my practice, not just improve, on the patient case acceptance, because I can then easily see, okay, what is my case acceptance, right? I mean, that's a hard number to track. What is my follow-up rate? What are we following up with patients? I'm very interested to hear about the, like, people 7+ days after. I think we have a really hard time getting that. I mean, we fail miserably there. So
it's not easy. It's
no,
not easy.
it's tough.
In a busy
Yeah,
practice,
tough.
it's not
Yeah.
easy. There's just a lot of things. And so, yeah, the reporting is key. And this is the other thing that, in terms of our culture, we're all about data. And when you put in systems and flows, what it allows you to do is track all the point of sale outcomes. And it's not just there to serve it back to our customers, which we do, and we'll talk about reporting and all that. What's also critical is that we are able to assess all these point of sale outcomes and continue to optimize the algorithms, the formulae, to continue to enhance and improve the flow and the outcomes, right? So we can build intel inside into the flow as the more data we see, the more outcomes we see, the more we're able to grind it and improve the outcomes. So, it helps. We have some really great integrations with the leading softwares. So the key here, though, is adoption. In order for you to track your case acceptance, you got to lean in and you got to use a tool all the time, not just after you don't get accepted by Care Credit or after you've pitched it from your system and you get to know. If you do that, you won't have clean data. But if you use this flow and this system to present all of your treatment, you're going to finally get clean, true case acceptance and conversion data that you can benchmark and then work with your team to improve and rely on. So, you can see all of it. You can see this, it actually sucks in the status of each of your diagnosed treatments to see whether it's impending or accepted or declined. So we actually can learn a lot before we even get started. And then obviously we post back, so it's all kind of goes back in, and it's clean in that way. So that, not everyone's into data, but you should be. So that's there. So, kind of trying to wrap up and giving some time for questions. We've talked about a lot tonight in terms of the conversion dilemma, and Dr. Daoud, I appreciate, the generosity of your time, but the transparency into some of the issues that you faced over time. Hopefully what we've done is we've really helped outline these three things and really helped to solve for these three things. So in terms of that disjointed fee and payment discussion, bringing it all together on one platform with this concept of open choice, hopefully helps to solve for that disjointed discussion. That the roulette, the Russian roulette of, are you going to get accepted by this lender or that, or should I put them in Proceed, or should I do Sunbit for this one? Let me look at the, what brand of handbag they have. Oh, they look like somebody I should send to Sunbit. All that stuff, by getting out of that wheel and just having a single application with multiple lenders that serve different credit tiers, you kind of get out of that wheel. And do that. And then, like I said, hopefully with good integrated systems, you can finally get a handle on, where you are and where you want to go. So anything you wanted to add, Dr. Daoud?
No, I'm really excited about it. And I know obviously this is continuing to grow and with more, more and more lenders that are coming on board. But I think for me, I think you kind of summed it up as you got to look at this as more than just a lending option, right? I think this is a more of I like the name actually, right? Like AcceptCare. I think this is really a case acceptance platform versus just financial application. So I think you're onto something here, and I think it's going to be pretty big. And
it's not for the meek. And your team, they may not like change. If you've got a who moved my cheese, situation. Oh, yeah. I don't know that I can help, but if you do want to transform and you have a growth mindset, it's definitely something we would love for you to try. And so if you are interested in trying it, It's like I said, it's not necessarily for everyone. So if you're really excited about this opportunity, what I would ask you to ask yourself, because we really want to get practices that are ready to try to transform the way they're presenting treatment. So we want practices that are ready to present the financial arrangements this way to every patient, so we can get good data, actually match up benchmark case acceptance and see improvement. We want that. We definitely, want you to process all the payments, through it. We can walk you through what that entails and all that stuff. And then, of course, as part of a beta, we just want to be able to have open channel communication to get your feedback, to enhance the flow, to enhance the systems. So, any of those things. So if this matches up with you and your practice and where you are, please take out your phone, scan the QR code. We'd be happy to set up time with you. We'll be flexible on time, and we'd love to talk to you. We'd love to see what we can do to help your practice.
Awesome. All right, pass this over to Stephen.